Hello guys, today we'll have a discussion on the charts on the topics nutrition and protein energy malnutrition. I'm Dr. Srijit here, so let's start. Now we'll be discussing six charts in this and we'll go to the chart one now. Now this is the first chart. So the history is given. 45-year-old Anthony visited the general physician at the hospital nearby complaining of constipation since 3 days. The doctor, on hearing his diet history, suggested to include more fiber-rich food in his diet. This is the history. Now the questions are: what is dietary fiber? What is the significance of including it in our diet? Sources of dietary fiber, and what is the RDA of dietary fiber, or the recommended daily allowance of dietary fiber? Right. So moving answer would be dietary fiber is the unavailable or indigestible carbohydrate in the food. And these are the examples. This table has been taken from your textbook. Cellulose, hemicellulose, lignin, pectins, all are examples of dietary fibers. And you have the uses on the right side. So most dietary fiber actually helps to decrease the intestinal transit time of the food material, of the digested food, increase the stool bulk, and it is also fermentable by the colonic microflora. And additionally, it will reduce blood cholesterol, help to reduce the blood LDL cholesterol levels and total cholesterol, and to also reduce postprandial blood glucose, thereby bringing down the blood insulin levels too. So it is very useful or very healthy for people who are suffering from diabetes, hypertension, and hypercholesterolemia. And also, it gets rid of indigestion or constipation for some people, uh, like that. So this is digestive fiber. Dietary fiber. Now, two kinds of fibers are there: soluble fiber and insoluble fiber. So soluble, just a difference, like soluble fiber would absorb water, and insoluble fiber would add bulk to the food that you have eaten. Now these are the examples for soluble fiber on the left side, that are chia seeds, sweet potatoes, flax seeds, broccoli, oats. And we have insoluble fiber, the examples like bran cereals, whole grains, corn, green beans, fruits with skin and all. So these are the examples for two types of fiber. And the recommended daily allowance for fiber is 20 to 30 grams per day. Okay. So that's chart one. Now moving over to chart two. Two, the history is like this. A 30-year-old diabetic lady approached a dietitian asking for a diet to reduce her weight. The dietitian suggested changing her daily diet to food items with lesser glycemic index. So the questions are: define glycemic index. How was low glycemic index food helpful for this lady? And list out three food items, each with high and low glycemic index. The dietitian even allowed her to have one or two ice creams in a week. Why is that so? So all these questions we have to answer. So moving on to the answer, glycemic index is a value assigned to foods based on how quickly or how high these foods can cause increase in blood glucose levels, right? So it is actually mathematically calculated by taking the area below the test meal, dividing it by the area below the reference meal. So if you can see the area below the black curve here, the black curve here can be seen. Yes, yes. This is the black curve here. The area below the black curve is this much. This much area divided by the area below the red curve, which is the reference meal, that you can take it as 50 gram of carbohydrate or glucose as a reference food, and compare it to other test materials or whatever foods you need to find the glycemic index of. So this is the mathematical way to find out with the help of an graph. So it actually means how high the blood these foodstuffs can cause an increase in blood glucose level, or how fast, right? Low GI foods, low glycemic index produce a gradual rise in blood sugar and insulin levels, right? So these are the food items in order of decreasing glycemic index. So you can maybe tell the first three items can be classified as low glycemic index, and the others can be classified as high glycemic index. So these are the examples for both kinds of glycemic index foodstuffs. So you can see that At the end of the table, you have ice cream again, which is a low index glycemic index. So why did the doctor suggest the ice cream, that the patient can have ice cream if she wants 1 or 2 times a week, right? This is because ice cream contains sugar, but it and still has a low glycemic index because it has a lot of fat in it, which actually prevents absorption of glucose, or it slows down the absorption of glucose. So that makes ice cream a low glycemic index, and that actually can be eaten by or taken by consumed by the diabetic patients if they wish, maybe 1 or 2 times a week, not more. Okay, so this is about 2. Now we'll move over to chart 3. Part 3 is this. The history is this. The 33-year-old person reported to the psychiatry OPD with complaints of low mood and lethargy. The doctor diagnosed it as clinical depression and prescribed some antidepressants. She also asked him to exercise regularly and have following capsules, which is given in the picture, once daily, right? So what are these compounds known as? So it is given already, omega 3, yes. So what are these group of compounds known as? Why are they named so? Examples of each type, sources of these compounds, and the significance of these compounds. Yes. So we'll see the answer. So the answer to that chart is polyunsaturated fatty acids, and there are 3 kinds of PUFAs, which are omega 3 fatty acids, omega 6 fatty acids, and omega 9. So for the purpose of this chart discussion, we'll confine ourselves the discussion to omega 3 and 6. Now, if you look at the technique by which they name the fatty acids, you can see that the carboxyl group is at this end, and the naming starts from here, alpha, beta, gamma, like that. And the end, you have the end carbon, the end carbon at the most terminal end is named omega, right? And from there you have this is omega 1, this is omega 2, and this is omega 3, as indicated here. So this is how they get their names. And in polyunsaturated fatty acids, like for example in omega 3 fatty acids, the first double bond occurs at the omega 3 area, or the omega 3 point, whereas in omega 6 fatty acids, the first double bond will be encountered at the omega 6 point, omega 6 carbon. So likewise, we have omega 9 also. So that is how you actually denote or name the carbons for the fatty acids. Now we have, so likewise, if you check at different omega 3 fatty acids, these are the very famous examples under omega 3 fatty acids. We have alpha linolenic acid, eicosapentaenoic acid, docosahexaenoic acid, and all. So all these are omega 3. You can see that this is the first carbon, this is the second carbon, and this is the third carbon. So all the chains have double bonds starting from the omega 3 carbons. That is why they are classified under omega 3 fatty acids. Now, if you look at omega 6 fatty acids, again, the double bond starts at the sixth omega 6 position for all the chains. And the fatty acids examples are linoleic acid and arachidonic acid, docosapentaenoic acid. And moving on to omega 3 fatty acids, a little detail, DHA, which is docosahexaenoic acid, and eicosapentaenoic acid are long chain fatty acids. And ALA is an essential fatty acid. So by essential, wherever when you encounter a term essential, it usually means it is not synthesized in the body, you have to take it in the diet, right? So I mean, fully, no, it has to be, the person has to fully depend on the diet for that fatty acid. So that is found, such an essential fatty acid ALA is found in these things, and whereas these two are found in various kinds of fishes. So omega 3 varies according to the variety, the species of fishes actually. So these are the examples given. Now moving over to the health benefits of omega 3, you might have heard already omega 3 capsules are consumed by athletes, bodybuilders, or general public in commonly, because just to improve their immunity, their health, overall health and all, because as shown in this picture, it is brain function improves your brain function, eyesight, healthy skin, heart, joints, because all this polyunsaturated fatty acids, especially omega 3 fatty acids, are required for normal functioning of the cell membrane as well as the various cellular functions, right? So it is helpful to keep the body functioning normally. So yes, So comparing omega-3 and omega-6, one major difference you have to keep in mind is that always when you design a diet, or when you go to a dietitian or when you follow a diet, always keep in mind that the latest research shows that omega-3 fatty acids are actually anti-inflammatory and omega-6 are fatty acids are actually pro-inflammatory. So the balance of omega-3 and omega-6 is very important in your diet. So always keep the omega-3 fatty acids at a higher level content wise and omega-6 at the lower level. All the examples have been shown and also the functions have also been shown in the picture. So this is all about omega-3 and omega-6 and thereby that is the end of chart 3 and chart 4 we'll move on to the question is this: a 40-year-old man attended the clinic for annual health checkup. His BMI was found to be 35 kg per meter square and his waist circumference was 42 inches. So what is the disease he is suffering from? What is the BMI? How to calculate it? Name some hormones released by adipose tissue and their relation with this disease. What are the causes for this disease? What are the consequences of this disease? And finally, how to manage this condition. Right? So what is the disease he is suffering from? Obviously, we can diagnose it by telling obesity, right? Obesity is a diagnosis, and BMI is the formula where you can calculate the body mass index by dividing weight by height in meter square. Weight should be in kilogram, height in meter square. And this is the latest WHO classification criteria for BMI. So if you have less than 18.5, you are underweight. If you have more than or equal to 40 BMI, you are obese class 3, right? So and all the other ranges are there in between. So these are the hormones released from adipose tissue: leptin, adiponectin, and resistin. Right? Leptin, adiponectin. Now talking about leptin actually, increases food take. The obesity. If you have obesity will lead to leptin resistance. Actually, leptin is a molecule. Leptin helps in actually decreasing hunger. Okay, leptin is something that suppresses hunger and actually saves you from eating more. Actually, when you have obesity, the problem is you will develop leptin resistance and you will have increased hunger and decreased energy expenditure, which will lead to a increased food intake again and leading to obesity, and that would be a vicious cycle. So leptin resistance is the main issue that we face in obesity, one of the main issues. Then we have adiponectin on the other hand, which is another hormone released by adipose tissue. So the healthy adipose tissue, as you can see, there will be high adiponectin, which is responsible for its high anti-metabolic, anti-cancer, and anti-inflammatory effects. Whereas low adiponectin in these tissues can lead to in obese tissues can lead to obesity or cardiovascular disease, diabetes, and many inflammatory processes. So that is about adiponectin. Now, resistin follows a complex pathway. You don't have to know this pathway and all. Just understand that resistin increase can actually lead to cellular damage, a lot of free radicals being generated. Again, attacking the walls, free radicals attacking the walls of arteries, vessels, and leading to atherosclerosis. That can lead to stroke. So, a lot of things it is connected to. Again, cancer cells adhesion, metastasis. So, you can see this diagram, it is a complex mechanism. But resistin is something, if it is increased, it is bad. So, actually, leptin, if it is high, it is good, but resistin and adiponectin, if it is less, that would lead to. So what are the causes of obesity? See, genetics is there, overeating. You can imagine some of the very common causes when you think of obesity would be genetics, eating junk food, hormones, medications, smoking, insufficient sleep leading to stress and cortisol levels, high cortisol levels, sweetened carbonated drinks, sedentary lifestyle. All these causes can lead to obesity. Now, and there are a lot of things connected with obesity nowadays. Everything can be connected with obesity in one way or the other. So, these are the linkages between different diseases. Mental and physical diseases are connected with obesity. And coming to the management side of obesity, if the patient's of BMI is between 25 to 30, the doctors usually advise modifications in lifestyle, which consists of diet and exercise tailored to that person's needs. So diet and exercise when the BMI is between this. When the BMI is between 30 to 40, you advise pharmacotherapy which consists of drugs like orlistat, sibutramine and all, not very commonly used. These are the drugs which are available in the market. Now, if your BMI is more than 40, you can consider having surgery like bariatric surgery, liposuction surgery. A lot of surgeries are there, where a loop of there are various bariatric surgeries actually where the distal end of the intestine is cut and it is tied and connected to, I mean, the segment of intestine is cut and removed, and thereby decreasing the absorption of things. So whatever you eat is not fully absorbed. It will actually go out. Most of it is excreted as in an unabsorbed state. Okay, so that is bariatric surgery. You will learn more about bariatric surgery in your clinical postings next year, maybe. So that is about chart 4. Chart 5, this is the case. 2-year-old male baby presented to the pediatrics OPD with complaints of puffy face, bulging abdomen, irritability, and decreased appetite. On examination, hepatomegaly was present. They diagnosed him as a case of protein energy malnutrition. So, what is PEM? What are the different types of PEM, and what might be the probable PEM disorder here? So, list out some classical features of this disease. So, on observation, you can see there is a bulging pot belly and a moon face, thin and brittle hair is there. So, it is more in favor of kwashiorkor, which is an edematous PEM. You see, so PEM is a group of clinical condition that may result from a varying degree of protein deficiency and energy deficiency. It is a major public health problem in India and Africa. Types of PEM mostly are kwashiorkor, marasmus, and marasmic kwashiorkor. But we'll discuss about kwashiorkor and marasmus in this chapter. So this is a table from, it is a welcome classification of protein energy malnutrition, where the first row column is about the weight for age. So 80 to 60% weight for age is there, and edema is there. It is the patient is, or the child is said to be suffering from kwashiorkor. If edema is absent, he or she is just underweight. If it is less than 60 and edema is present, it is marasmic kwashiorkor, and if it is less than 60 and edema is not there, it is just the kid is suffering from marasmus. So this was the basic classification. Now you have protein energy malnutrition as shown here. You can see the kwashiorkor side, it is marginal energy but insufficient protein intake. Mostly protein insufficiency is the problem with kwashiorkor, and this is a disease that the first child gets when the new child comes. So kwashiorkor is derived from a tribal language in Africa, which means red, the second child or the red child or something. It actually it happens usually in those tribes when the second child comes and all the attention is given to the second child, and the first child suffers from protein deficiency. So that is, so naturally you can logically remember the age group of kwashiorkor is like about 2 years and all. When the child becomes older, he or she is more prone to kwashiorkor, right? So if you look at this side, which is marasmus, it is insufficient protein and energy intake together. So this is like full wasting of the body can be seen, and also energy insufficiency is also there. So the word name is to meaning is to waste away or dying away thing. So that is marasmus. So kwashiorkor, there will be symptoms like, say, signs like mooning of face, dependent edema. 1 to 5 years is usually the age, and the child would be usually irritable. Poor appetite would be there. Skin, you can find a peculiar finding like flaky paint dermatosis, where you can find skin peeling off like flakes of paint. So, and hair changes would be there. Hepatomegaly will be there due to fatty liver. So that is actually also responsible for the pot belly, along with the edema present along with that. So these are the symptoms that we just mentioned. So this is how the baby looks like in kwashiorkor. So moving on to the last chart, which is chart 6. The chart is about this history. The 6-month-old baby, male baby, presented to the pediatrics OPD with complaints of a skinny face, shrunken abdomen, and generalized wasting. His appetite was normal. On examination, loss of subcutaneous fat is there. They diagnosed him as a case of PEM. Now the same questions are there here, and the picture is different. So you can diagnose easily that this is marasmus, that is generalized wasting, and you have simian facies, loss of muscle mass, and no edema is present anywhere. So it is mostly in favor of marasmus. So the same definitions that we saw just now in the earlier slide. This is again, and this is Marasmus is mostly the symptoms like skinny old man appearance is there, or simian face. Infants less than 1 year is usually affected. The baby would be alert, not irritated or something like that. They will be alert mostly. Good appetite would be there. Skin would be dry and wrinkled. Hair changes won't be there, unlike in kwashiorkor. So you have marasmus. The hepatomegaly also would be absent. So mostly thin, very wasted baby, right? The muscle wasting would be there. Very thin, shriveled kind of built the babies would have. So with this, we end the chart discussion about nutrition and malnutrition. Thank you for listening.